Breast cancer scares women. It's the most feared illness that women can get. And yet there are 10 times as many deaths from heart disease, from heart attacks, than there are from breast cancer. There are about 200,000 new cases of breast cancer every year and about 40,000 deaths. Still a very significant number. This whole field is very confusing and complicated, and making an intelligent decision about what to do about it really becomes a challenge. But before we start with the treatment, let's take a look at some of the risk factors for who's at risk for getting breast cancer. We know that genetic factors are important, but they probably only account for about 5 or 10% of all cancers. And it's thought that about 70% of cancers are from unknown cause, but I think that's naive. I think we know that it's our environmental toxins that are causing that, in conjunction with our genetics and our lifestyle factors. We know that if you have an early menarche, if you have your first period at age 12 or younger, or you have a menopause at age 50 or later, or you have a child after the age of 30 that's your first child, that your risk for breast cancer goes up. We know that hormone replacement therapy, all that business that was supposed to be fantastic to prevent cancer, to prevent heart disease and strokes, to prevent all kinds of other healthcare issues, turned out to be absolutely false. And the biggest drop in breast cancer came in the early 2000s when we exposed through the Women's Health Initiative that this was a disease that was caused by hormone replacement therapy, and it dropped about 7% over the next couple of years. Birth control pills increase the risk for breast cancer. Just one drink a day of alcohol will increase the risk by about 15%. So we know that these are factors that we should pay attention to. Insulin resistance, another problem that's very common because we have this amazing amount of inflammation that's caused by lifestyle factors that we don't pay attention to, like not enough sleep and stress and what we eat, being overweight. Then there are myths that we have to remember have not been proven to cause cancer. Things like wearing wire bras, or are using antiperspirants of one type or another, or having an abortion. So they're not issues. So let's look at some of the statistics, okay, on who gets, how many people actually get breast cancer. By the time you're 85, 1 person in 8 will get breast cancer. And by the time you're at age 30, maybe 1 in 250 people will get breast cancer. 25% of all cancers that there are ductal carcinoma in situ, which are ones that are not that serious, and probably only 1 or 2% will be fatal. About 25% of the cancers that are 1 centimeter in size, just little tiny things that are less than ½ an inch, have already spread. So how much good is early detection doing you? For those people, not much. It's the leading cause of death in women from age 40 to 44. When we do the kinds of workups that we do for early detection, we're looking at clinical breast exams where somebody is an expert who's feeling for it, your doctor's checking for it. They miss 40% of cancers. The mammograms miss 15 to 25% of cancers, and also ultrasounds as well do. MRIs are very accurate, but they require using a dye, which can be toxic to the body. They miss about 5% of cancers, but about 80% of the time they're overdiagnosing. The only real test that's accurate here that should be used in the mainstream is the mammotherm, and it's a test that has not been approved by the FDA as a standalone test, although back in 1982 it was approved as a test that could be used in conjunction with mammography. And this is where we start to get into some of the politics of what's happening in breast cancer screening, which you'll find in another section of this website. Now, there are 3 major types of breast cancer. There's ductal cancer, which occurs in the ducts of the breast. There's lobular cancer, which occurs in the lobes of the breast. And then there's something called DCIS, ductal carcinoma in situ, which, as I mentioned, is something that is 25% of all the cancers we find, but it is not very lethal. Only 1 to maybe 2% of people who have that will ultimately die from it. And yet women are generally terrified if they have this found on a biopsy, and they're afraid not to take the surgery, radiation, and chemotherapy a lot of the time. It's much the same as prostate cancer in the early stages of it, and that too is described in another area of this site. The treatment for breast cancer is pretty straightforward in the mainstream, according to the mainstream people. They're interested in surgery, radiation, and chemotherapy. In fact, the lobbying for this is so strong that it's a felony in some states like California, where if you don't use those 3 treatments and try to do something else, you'll go to jail, you'll lose your license, and you'll be fined. The complementary and alternative therapies should be integrated into the mainstream therapies. You'd like to have as many choices as you can, and I think it's important that you look at the different choices that there are. Some of it makes so much sense that it's almost insane not to apply it if you're going to do an integrative approach to the mainstream therapies. So things like balancing the biological terrain, which means making sure that the environment inside the body where the cells live is as healthy as it can be for cells. Doing things like making sure that we don't have too much acid in our system, and we need to boost our immune system. We need to make sure that our intestinal tract is intact, and that too is described in another section of this site. And we have to make sure that our lifestyle factors are appreciated and really taken care of in a way that's optimal. There are a lot of other therapies that are possible as well in mainstream medicine, and more so even in complementary and alternative therapies. And in this area, we have things like intravenous vitamin C, where research is being done by the National Institutes of Health as we speak. There's the Gerson therapy, that's a nutritional therapy from Mexico. There's the Hoxy therapy and hyperthermia. There's prayer and meditation and group support that all have interesting aspects to them that we should be looking at as adjuncts to what we're doing whenever we're using treatment. Vitamin D3 is another one. There are a lot of natural approaches that should be added to as an integrative approach to the mainstream treatments. What you need to know as a patient is that if you don't know you have cancer yet and you're interested in not getting it, prevention is your answer. It's not that it should be just screening for early detection. And of course, you should do all the things that you can to maintain a healthy lifestyle, because those are the things that keep you from getting cancer. The exercise, the diet, the stress reduction, the sleep, the weight control, all factors that are in your control. So when we think of breast cancer, don't be so frightened by it. It's preventable, and there are ways of doing early detection that make some sense.